February 10th, 2010. Today we are in the Catskill Mountains and it's snowing quite heavily this Wednesday. And I would like to take this liberty to speak to you a little bit about some of the more common topics and trends that I have seen in our practice with patients that have been walking in, new and past patients. Today I would like to talk to you a little bit about realistic expectations of what you can gain out of pain control. Now, many of our patients prior to coming here have had some experience with the local pain control clinics. Now, to me, this always raises a question mark because we see these folks coming in usually with a vast array of prescription medications. And the first thing that comes to mind when we're talking about many of these opioid-based substances, it's not a matter of if you will become dependent on the drug. It is simply a matter of when. So if you take the drugs frequently enough, over a long enough period of time, you will become dependent, which is an issue. The problem is with these sort of medications is they are very effective in the short term of dulling, making you feel as if the symptoms are not in the forefront. However, most people tell me when they take them, they still realize there is pain and it's just not a major occurrence at that point in their life. The issue becomes is as you become dependent upon these medications, you're dealing with dual problems. The first is the problem of the pain, and the second is the problem of the dependency of the drugs. So what happens is necessarily as the availability of these drugs becomes decreased because either you're trying to wean off them or the physician has finally wised up and said, well, maybe we should back off on this a little bit, your pain necessarily skyrockets. You haven't really addressed the pain, you've only masked the pain with these medications. And the dual problem of dependency and pain is much worse than the pain was at the beginning. So many of those patients who come into the office with a level 3 or 4 pain prior to taking those medications, often after they become dependent on the drug and try to get off the drug, are at 8, 9, 10 and above and are acting somewhat irrationally. So what I try to frame for patients in situations such as this is you have to have realistic expectations about pain control and what you can expect and what it can do for you. Yes, I understand that acupuncture and chiropractic is not an immediate fix in many cases for chronic pain situations. I understand that very well and very clearly. However, research shows that long-term use of opioid drugs is not a good thing for you. And if you're going to be in a worse place at the end of treatment than you were at the beginning of treatment, and I might be talking 3, 6, 8 months, a year down the road, why did you even begin? Why did the physician even begin this course of treatment? So in my mind, it is always better to understand that there are other forms of pain treatment and maybe you're going to have to learn to live with some discomfort. Some people it's more than others, and I understand it, and I truly feel for these folks. However, being drug dependent on top of that always, always, always makes these situations worse. I can't stress that deeply enough. I've had conversations with professionals in the drug rehabilitation and treatment field, and they have come to the same conclusion as I. It is almost unconscionable for these pain clinics and some of these physicians who just write these scripts in a willy-nilly fashion because all they are doing is addicting these folks. They are really not addressing the pain, and it is just a huge, huge problem out there. There are more people walking the streets that are addicted to prescription painkillers than there are to all the crack, heroin, cocaine, marijuana, whatever you may have on the streets. So it is a huge problem in our society. So once again, I would ask you, if you have pain, think about it reasonably and rationally. I understand when you're in a situation like that, you don't always make the clearest decisions. But please think 2, 3, 4 times before undergoing these types of pain treatments, and call somebody like me about these, what can be done for you, what can be offered for you, and let's speak and sit down about this rationally, and hopefully we can come to some sort of answer or conclusion for your problems. Once again, you can reach me at 845-647-8866 or www.lonstein.com. You can check out my Facebook page at Lonstein Chiropractic and Acupuncture, or you can email me at info@lonstein.com. I welcome any of your inquiries, and we will follow up this video with another one shortly.